Do you ever wake up in the middle of the night with a burning, tingling sensation in your feet or hands that just won't go away? Maybe your fingers feel numb when you pick up your morning coffee cup. Maybe your feet feel like they're on fire or like hundreds of tiny needles are poking through your skin. You've probably been told it's just part of getting older. You've probably accepted it as your new normal. But what if I told you it's not normal? And more importantly, it's not permanent. What if one single vitamin, something most seniors are severely lacking, could begin reversing that nerve damage in as little as 14 days. Today, I'm going to show you exactly what that vitamin is, why doctors rarely talk about it, and most importantly, how you can start using it immediately to reclaim the comfort and freedom in your own body. So stay with me, because what you're about to hear could genuinely change your life. First, let me tell you something that might surprise you. Nerve damage, the medical term is peripheral neuropathy, affects over 20 million Americans, and the majority of those people are over the age of 60. That means if you're watching this right now, there is a very high chance that either you are experiencing symptoms of nerve damage or someone you love is silently suffering with it right now. And here's the really sad part. Most people, most seniors, go to their doctor complaining about tingling feet, numbness in the hands, burning sensations, or loss of balance, and they're handed a prescription for pain medication. The medication covers up the pain, but it does nothing to heal the nerve itself. It's like putting a piece of tape over a cracked pipe. The tape hides the problem, but the pipe keeps leaking underneath. That's why this conversation is so important. Because there is real, clinical, science-backed evidence that a specific vitamin can actually repair damaged nerves, not mask the pain, not temporarily numb the area, but actually help your body rebuild and heal nerve tissue from the inside out. And the best part? This vitamin is not expensive, it's not a prescription drug, it's not some miracle supplement you've never heard of. It is something your body needs every single day, and something that most seniors over 60 are critically deficient in. Let's talk about what's really going on inside your body first, because once you understand the problem, the solution will make perfect sense. Your nervous system is like the electrical wiring of your entire body. Think of it like the wiring in your home. When the wiring works perfectly, every light turns on, every appliance runs smoothly, and everything in your house functions the way it should. But when that wiring gets damaged or frayed, the lights flicker, the appliances stop working properly, things start going wrong in ways that seem random and confusing. That is exactly what happens when your nerves are damaged. Your nerves are responsible for sending signals from your brain to every single part of your body, your hands, your feet, your legs, your organs. When those signals get disrupted because the nerves are damaged or deteriorating, you feel it. You feel it as tingling, as burning, as numbness, as sharp stabbing pain, as muscle weakness, as loss of balance. Many seniors also experience sensitivity to touch, where even the light weight of a bedsheet on their feet causes discomfort. Some lose the ability to feel temperature properly, others feel like they're walking on cotton balls. Now here's the critical question. Why do seniors develop nerve damage more than younger people? There are several reasons. The first reason is that natural aging slows down nerve repair. When you were young, your body repaired nerve damage quickly and efficiently. But after age 60, that repair process slows dramatically. Your body simply doesn't regenerate nerve tissue as fast as it used to. The second reason is that circulation decreases with age. Your nerves need a rich, steady blood supply to stay healthy. As we age, circulation naturally decreases. This means your nerves in the extremities, your hands and feet, receive less oxygen and fewer nutrients. Over time, they begin to deteriorate. The third reason is that nutritional deficiencies become more common. And this is the big one. This is the one we're going to spend the most time on today. As we age, our body's ability to absorb certain vitamins and nutrients from food significantly declines. We produce less stomach acid, our digestive systems become less efficient, and as a result, even if you're eating well, even if you think you're getting all the right nutrients, your aging body may not be absorbing them properly, and when it comes to nerve health, there is one vitamin above all others that seniors are consistently and critically deficient in. Are you ready to find out what it is? The vitamin I'm talking about is vitamin B12. Now, you may have heard of B12 before. Maybe your doctor has mentioned it. Maybe you've seen it on the label of an energy drink or a multivitamin. But I want you to really understand what B12 does for your nerves, because most people have no idea how critical this vitamin truly is for seniors over 60. Here is what vitamin B12 actually does in your body. Your nerves are covered by a protective coating called the myelin sheath. Think of it like the plastic insulation that covers electrical wires. That insulation keeps the electrical signal strong, clean, and properly directed. Now imagine stripping the insulation off those wires. The electricity becomes erratic. Signals get crossed, things stop working. That is exactly what happens when you don't have enough B12. Without adequate vitamin B12, your body cannot maintain the myelin sheath around your nerves. The protective coating begins to break down. The nerves become exposed and vulnerable. Signals misfire, and you begin to experience all those painful, uncomfortable symptoms: the tingling, the numbness, the burning, the weakness. And here's the shocking part. Studies show that up to 40% of adults over 60 have low or deficient levels of vitamin B12. 40%. That's nearly half of all seniors, and many of them have no idea, because B12 deficiency develops slowly, quietly, over months and sometimes years. By the time you notice the symptoms, the deficiency has often been present for a very long time. But here's the incredibly encouraging news that I really want you to hold on to today. Clinical research has shown that when B12 deficiency is corrected, when the body gets the B12 it needs, nerve tissue can begin to repair itself. Studies have documented significant improvement in neuropathy symptoms in as little as 2 weeks, just 14 days, when patients with B12 deficiency began supplementing properly. The tingling decreased, the burning sensations calmed, the numbness began to fade. Patients reported being able to sleep through the night again. Some regained feeling in their feet. Some were able to walk more steadily without fear of falling. This isn't wishful thinking. This is documented, peer-reviewed medical science. But there's an important detail we need to talk about, because not all B12 supplementation works equally well for seniors. And this is where a lot of people go wrong. Here's something your doctor may not have explained to you. Even if you're already taking a B12 supplement or eating B12-rich foods like meat, fish, and eggs, there's a very good chance your body isn't actually absorbing it effectively. Why? Because of something called intrinsic factor. Let me explain this simply. In order for vitamin B12 to be absorbed from your digestive system into your bloodstream, your stomach needs to produce a special protein called intrinsic factor. Think of intrinsic factor as the key that unlocks the door for B12 to enter your body. Here's the problem. As we age, and especially after age 60, our stomachs produce significantly less intrinsic factor. The key becomes harder to find, and without that key, even if you swallow B12 pills or eat B12-rich foods, much of that B12 simply passes through your body unused. This is why so many seniors remain B12 deficient even when they think they're taking care of themselves. There's also another major factor that affects millions of seniors: medication interference. One of the most commonly prescribed medications for seniors over 60 is metformin, used for type 2 diabetes. Clinical studies have confirmed that long-term metformin use significantly depletes B12 levels in the body. Additionally, proton pump inhibitors, those acid-reducing medications like omeprazole or pantoprazole that so many seniors take for heartburn and acid reflux, these medications reduce stomach acid production. And since stomach acid is essential for releasing B12 from food, less acid means less B12 absorption. If you're over 60 and taking either of these types of medications, please pay very close attention to what I'm about to say next. You need to have your B12 levels checked today, not next month, not at your next routine appointment 6 months from now. Ask your doctor specifically for a serum B12 blood test. It's simple, it's inexpensive, and it could reveal the root cause of symptoms you've been struggling with for years. I want to stop here for just a moment and speak to you directly. If you are over 60, or if you're watching this because you care for an elderly parent or a loved one, I want you to really hear this. The symptoms of nerve damage are not something you have to simply endure. They are not an inevitable part of aging that you must accept. Tingling feet, burning sensations, numb hands, loss of balance. sleepless nights from nerve pain. These are signals. Your body is trying to tell you something, and now you're beginning to understand what it might be saying. You deserve to feel comfortable in your own body. You deserve to sleep peacefully through the night. You deserve to walk with confidence and live without constant pain. So please keep watching, because I still have more critical information to share with you, including the best forms of B12 for seniors, the right dosages, the warning signs you should never ignore, and the other nutrients that work alongside B12 to supercharge nerve healing. And if this information is helping you, please hit that like button right now. It helps more seniors just like you find this life-changing content. Now let's talk about the warning signs. Because B12 deficiency is sneaky. It creeps up slowly, and many of its symptoms are easily mistaken for other conditions, or simply blamed on old age. Here are the most important warning signs that seniors over 60 should watch for. The first warning sign is tingling or numbness in the hands and feet. This is the most classic sign of B12 deficiency-related nerve damage. If you regularly feel pins and needles in your fingers or toes, especially at rest or at night, this should not be ignored. The second warning sign is unexplained fatigue and weakness, not just normal tiredness. A deep, heavy fatigue that rest doesn't fix. Many seniors with B12 deficiency describe feeling exhausted even after a full night's sleep. The third warning sign is balance problems and difficulty walking. B12 deficiency affects the nerves in your spinal cord that control coordination and balance. If you've noticed you're more unsteady on your feet, bumping into things, or feeling like your legs are unreliable, this is a serious warning sign. And for seniors, poor balance means an increased risk of falls. And falls, as we all know, can be absolutely devastating at this stage of life. The fourth warning sign is memory problems and mental fog. This one surprises many people. B12 deficiency can actually affect the brain, leading to confusion, forgetfulness, difficulty concentrating, and what many seniors describe as brain fog. In fact, severe B12 deficiency can mimic the early symptoms of dementia. Many seniors who have been concerned about their memory, and even told they may be in the early stages of cognitive decline, have experienced dramatic improvement after addressing a B12 deficiency. The fifth warning sign is mood changes, including depression and irritability. Your nervous system regulates your mood. B12 is essential for producing the brain chemicals, called neurotransmitters, that keep you feeling emotionally stable and positive. When B12 is low, depression, anxiety, and irritability often follow. The sixth warning sign is a smooth, pale, or inflamed tongue. This one is less commonly known. B12 deficiency can cause a condition where the tongue becomes swollen, smooth, and loses its normal bumpy texture. Some people also experience mouth sores or a burning sensation on the tongue. The seventh warning sign is vision changes. B12 deficiency can damage the optic nerve, the nerve that connects your eyes to your brain, leading to blurred or disturbed vision. If you've noticed changes in your vision that your optometrist can't fully explain, B12 could be a contributing factor. Now, how many of those signs resonated with you? Even one or two of these symptoms is enough reason to get your B12 levels checked immediately. Don't wait. Don't dismiss it as simply getting older. So now that you understand what B12 does, why seniors are deficient, and what the warning signs look like, let's talk about the most important question. How should seniors actually take B12 to get the maximum benefit for nerve healing? There are several forms of B12 supplementation, and they are not all created equal for seniors. The first form is cyanocobalamin. This is the cheapest and most common form of B12 found in standard multivitamins and low-cost supplements. Your body has to convert it into a usable form before it can work. For many seniors, especially those with absorption issues, this conversion process is inefficient. You may not get the full benefit. The second form is methylcobalamin. This is the form of B12 that research consistently shows is best for nerve health in seniors. It is the active, ready-to-use form that your body can utilize immediately without conversion. Multiple clinical studies on peripheral neuropathy have specifically used methylcobalamin and documented significant improvements in nerve pain, tingling, and function. If you are choosing a B12 supplement for nerve health, look for methylcobalamin specifically. The third form is sublingual B12, which means under the tongue. Because many seniors struggle with digestive absorption of B12, sublingual supplementation, where you dissolve a tablet or liquid drops under your tongue, bypasses the digestive system entirely and delivers B12 directly into the bloodstream. For seniors with known absorption issues, sublingual methylcobalamin is often the most effective option. The fourth form is B12 injections. In cases of severe deficiency or severe neuropathy, doctors sometimes prescribe B12 injections. These bypass all digestive absorption issues and deliver B12 directly into the bloodstream. If your nerve damage is advanced, speak to your doctor about whether injections might be appropriate for you. Now, what about dosage? Most healthy adults need around 2.4 micrograms of B12 per day, but seniors with deficiency or nerve damage often benefit from significantly higher therapeutic doses, sometimes 500 to 1,000 micrograms per day, especially in the initial recovery period. However, please speak to your doctor before starting any new supplement regimen, especially at higher doses. Everyone's situation is different, and your doctor can help you determine the right approach based on your blood levels and overall health. Now, here's a bonus that I promised you earlier, and this information can significantly accelerate your nerve healing results. B12 doesn't work alone. There are two other nutrients that work in powerful combination with B12 to rebuild and protect nerve health. Together, these three form what I like to call the nerve healing power trio. The first ally is alpha-lipoic acid, also known as ALA. Alpha-lipoic acid is a powerful antioxidant that has been extensively studied for its effects on neuropathy, specifically diabetic neuropathy. It works by reducing oxidative stress in nerve tissue, essentially fighting the cellular damage that causes nerves to deteriorate. Studies have shown that ALA can significantly reduce burning pain, tingling, and numbness in peripheral neuropathy patients. It also has the unique ability to regenerate other antioxidants in the body, giving it a double punch against nerve damage. Look for ALA supplements in dosages of 300 to 600 milligrams per day, taken with meals. Again, discuss this with your healthcare provider. The second ally is vitamin D. This may surprise you. Most people think of vitamin D as purely a bone health vitamin, but emerging research has revealed a powerful connection between vitamin D and nerve health. Vitamin D plays a direct role in nerve growth, nerve repair, and reducing inflammation in the nervous system. And just like B12, vitamin D deficiency is extremely common in seniors over 60, particularly those who spend limited time outdoors. Studies have found that seniors with low vitamin D levels have significantly higher rates of peripheral neuropathy, and correcting that deficiency has shown meaningful improvements in nerve pain and function. A simple blood test can check your vitamin D levels. Ask for it alongside your B12 test. When B12, alpha-lipoic acid, and vitamin D are combined, the results for nerve healing can be significantly more powerful than using any one of them alone. Supplementation is essential, but it works best when combined with supportive lifestyle habits. Here are simple but powerful things you can do every day to help your nerves heal. The first habit is to keep your blood sugar under control. High blood sugar is one of the most destructive forces for nerve tissue. Even if you haven't been diagnosed with diabetes, chronically elevated blood sugar damages nerves over time. Reduce your intake of refined sugar, white bread, white rice, and sugary beverages. The second habit is to move your body every day. Gentle, regular movement improves circulation, which means more blood and more nutrients reaching your nerves. You don't need to run marathons. A gentle 20-minute walk each day can make a meaningful difference. Swimming, gentle yoga, and chair exercises are also excellent options for seniors. The third habit is to eat nerve-nourishing foods. Focus on foods rich in B vitamins, lean meats, fish, eggs, and dark leafy greens. Include anti-inflammatory foods like fatty fish, such as salmon and sardines, walnuts, flax seeds, berries, and olive oil. These foods reduce inflammation in the nervous system and provide the raw materials your nerves need to heal. The fourth habit is to stay hydrated. Dehydration thickens the blood and reduces circulation to extremities, worsening nerve symptoms. Seniors often underdrink water because the sense of thirst decreases with age. Aim for at least 6 to 8 glasses of water daily, even if you don't feel particularly thirsty. The fifth habit is to protect your feet. If you have numbness or reduced sensation in your feet, you may not feel minor injuries, blisters, or cuts. Inspect your feet daily. Wear comfortable, well-fitting shoes. Never walk barefoot outside. Small foot injuries that go unnoticed can become serious problems very quickly. The sixth habit is to limit alcohol. Alcohol is directly toxic to nerve tissue. Even moderate regular drinking can worsen neuropathy symptoms significantly. If you drink, consider reducing your intake substantially during your recovery period. So what can you realistically expect when you begin addressing your B12 deficiency and supporting your nerve health? Here is a realistic timeline. During days 1 through 3, you begin supplementing with methylcobalamin B12. Your body starts replenishing depleted stores. You may not notice dramatic changes yet, but the healing process is beginning at a cellular level. During days 4 through 7, many people report a slight reduction in the intensity of tingling and burning sensations. Sleep may begin to improve as nighttime nerve pain decreases slightly. Energy levels often begin to pick up as B12 levels rise. During days 7 through 10, there is continued improvement in tingling and numbness for many individuals. Some report feeling sensations returning to previously numb areas, which can feel strange at first, but is actually a sign of nerve healing. During days 10 through 14, many seniors who were significantly B12 deficient report noticeable improvements in their quality of life within this period. Reduced pain, better sleep, improved balance, greater energy, a sense of hope and relief. One important note, the degree and speed of improvement depends on how severe your deficiency is, how long you've been deficient, and other individual health factors. Some people see rapid improvement. Others see more gradual progress over weeks and months. Long-standing nerve damage takes longer to heal, but improvement is possible. Don't give up. Let's bring everything together. Today, you've learned that nerve damage, the tingling, burning, numbness, and pain that millions of seniors struggle with is often not just a part of aging. It is frequently caused or significantly worsened by a critical deficiency in vitamin B12, a deficiency that affects nearly half of all adults over 60. You've learned that B12 protects and rebuilds the protective coating around your nerves, that seniors absorb B12 poorly due to reduced stomach acid and medication interactions, that the right form, methylcobalamin, combined with alpha lipoic acid and vitamin D, creates a powerful nerve healing combination. You've learned the 7 warning signs to watch for. You've learned the lifestyle habits that accelerate healing. And you now have a realistic picture of what recovery can look like over 14 days. But none of this information matters unless you take action. So here is your assignment for today, and I want you to take this seriously. Call your doctor and ask for a serum B12 test and a vitamin D test today. Review the warning signs I shared with you and take note of how many apply to you or someone you love. Talk to your doctor about methylcobalamin supplementation and whether it's right for your situation. And start one lifestyle change today. Drink an extra glass of water, take a 10-minute walk, reduce sugar at dinner tonight. Small steps lead to big changes. You have spent decades taking care of your family, your work, your responsibilities. Now it is time to take care of you. Your nerves can heal, your body wants to heal, and now you have the knowledge to give it what it needs. You are not too old, it is not too late, and you absolutely deserve to feel better. If this video helped you today, if it answered questions you've had for a long time, or gave you hope that things can get better, please do me a quick favor. Give this video a thumbs up. It helps other seniors who need this information find it. Subscribe to our channel and hit the notification bell. We post new senior health content every week, and you don't want to miss what's coming next. Drop a comment below and tell me, have you ever experienced tingling or numbness in your hands or feet? Have you ever had your B12 levels checked? I read every single comment and I love hearing from you. And please share this video with a friend, a family member, or a loved one over 60 who might be suffering in silence. You could be changing someone's life today. Thank you so much for watching. Take good care of yourself because you are worth it. And I'll see you in the next video.